Hey everyone, welcome back to my channel. In my clinic, almost every single day, a patient or their family member pulls me aside and quietly asks, "Doctor, I've heard that ginseng is too nourishing, that cancer patients shouldn't touch it because it'll feed the cancer cells. Is that actually true?" And every time I see that anxious look on their face, I completely get it. You want to support your body, but you're terrified of accidentally becoming the cancer's best friend. That inner conflict is genuinely exhausting. Maybe your fridge is stacked with ginseng and American ginseng that relatives brought over, but you're too scared to touch it and it's just sitting there going to waste. So today I want to give you a responsible, straight answer. One that's going to challenge what a lot of people believe. Ginseng itself is not the villain. It is not cancer cell food. In the fight against cancer through TCM, ginseng is actually a powerful weapon. But like any weapon, it cuts both ways. Used correctly, it can be a lifeline, helping you survive chemotherapy and rebuild your immune system. Used incorrectly, at the wrong time for the wrong body type, it really can do harm. So, can you take it? And when should you absolutely stay away from it? In today's video, I'm going to walk you through exactly how to figure that out. This is about your health and your life. Please watch to the end. First, let's get the fundamentals straight. In TCM cancer treatment, everything comes back to 4 words. 扶正祛邪, support the body's vital energy and drive out the pathogen. What is the vital energy? 正. It's your immune system, your constitution, your vitality, your energy reserves. What is the pathogen? 邪. It's the cancer cells, the inflammatory toxins inside your body. Ginseng is the #1 herb for supporting vital energy. Think of it as delivering supplies to your body's army. Many cancer patients, especially after surgery or multiple rounds of chemo, have been through the ringer. They have no energy left. In TCM terms, this is called qi deficiency. If you don't resupply that army, if you don't use ginseng to replenish the qi, what does your immune system have left to fight the cancer with? So for most patients in the middle or late stages, or those recovering from surgery with a weakened body, ginseng is needed to hold things together. But, and this is a huge but, if your body is in the middle of an active battle, or if it's overloaded with toxic waste that hasn't been cleared out yet, flooding it with supplies doesn't just help the good guys, it feeds the bad guys too, the cancer cells and the inflammation. This is the most important part of the video. Grab a pen, take a screenshot, save this somewhere. If you fall into any of these 3 categories, put the ginseng away and don't touch it. Situation number 1, you're in an acute infection or fever. What does this mean? You're running a high fever. You have a bad cold or flu. You just had surgery and the wound is red, swollen, or infected. You have an acute lung infection and you're coughing up yellow phlegm. In this state, your body has what TCM calls excess fire blazing inside. Ginseng tonifies qi, and in TCM, excess qi turns to fire. Taking ginseng now is like pouring fuel on the flames. You'll find that your fever climbs higher and the inflammation becomes harder to resolve. Rule: anytime there's fever or acute inflammation, stop all ginseng immediately. Situation number 2, you have a clear excess heat or damp heat constitution. Many cancer patients aren't depleted. They're blocked. How do you know if this is you? Simple. Go look in the mirror right now and stick out your tongue. If your tongue coating is very thick and yellow and greasy, like a heavy layer of yellow paste coating your tongue, and on top of that you're regularly constipated, have bad breath, a flushed face, and a short temper, that tells us your body is overloaded with toxic waste. Your priority is to clear and drain, not to tonify. Taking ginseng now will make you more congested and could worsen your condition. Situation number 3, this one catches the most people off guard. Severe yin deficiency with excess fire, but choosing the wrong type of ginseng. I see this constantly, especially in patients who have gone through radiation therapy. Think about what radiation does. It's like being cooked by fire. Afterwards, your body's fluids and moisture have been burned away. You feel intensely dry. Your palms and feet feel warm. You sweat at night. Your mouth is so parched, you're constantly reaching for water. Stick out your tongue and look. It's usually bright red with no coating at all. That's classic yin deficiency. Can you take ginseng in this case? Yes, but absolutely not red ginseng. Red ginseng is warming in nature. If you're already yin deficient, already low on water with excess fire, taking red ginseng is like adding fuel to a fire. You'll get nosebleeds. Many patients have this exact experience, assume they can't take ginseng and swear it off forever. The truth is, you just picked the wrong type. Okay, so you've cleared those 3 minefields. If your TCM doctor has assessed that your body truly needs support and tonification, how do you actually pick the right ginseng for you? There are so many varieties on the market. Here's the simplest formula I give cancer patients: type 1, red ginseng or Korean ginseng. Warm in nature, only suitable for patients who feel genuinely cold hands and feet, always chilly. That's yang deficiency, and red ginseng is your ally. But as we just covered, if you've had radiation or you tend to run hot, stay away. Type 2, white ginseng, more neutral in nature. If you're neither particularly cold nor hot, just low energy, a weak voice, poor appetite, this is a safe, reliable choice. Type 3, my top recommendation, American ginseng, also called Panax quinquefolius or flower flag ginseng. If you're not sure about your constitution, or you've just finished chemo or radiation and feel dried out and exhausted, American ginseng is the safest all-rounder. Why? Because American ginseng is unique. It tonifies qi without generating fire, and it also nourishes yin. It can boost your immune function while simultaneously easing the dry mouth and fatigue that follow chemo and radiation. For most cancer patients who tend toward heat but are also qi deficient, American ginseng is the go-to choice. How should you take it? Please don't do what they do in TV dramas, stewing a whole root in one go. The approach should be slow and steady. Take 3 to 5 grams per day, slice thin. You can hold the slices under your tongue, steep them in hot water like tea, or chew the softened pieces at the end. Consistent small doses work far better than one big hit. So, back to where we started. Can cancer patients take ginseng? Yes, but only with proper differentiation. Avoid it during acute infections. Avoid it when excess heat is dominant. For yin deficiency, choose American ginseng. For yang deficiency, choose red ginseng. That said, every patient's situation is different and complex. Before committing to a long-term regimen, I strongly recommend seeing a TCM physician in person. Let them check your tongue, feel your pulse. That's the safest path forward. I'm Dr. Yao, guiding your cancer journey with the wisdom of Chinese medicine. If you found this video helpful, please give it a like and share it with a friend or family member who needs it. See you in the next one.